How do you know when to use volume and when to use pressure when you're setting up your patient on the mechanical ventilator? As a recap, when you are in volume, you're telling the ventilator, I want you to push this much, and it gives the patient a volume that you have set in the ventilator, always based on ideal body weight, right? Which is a mixture of their gender and their height, but that's another video. So we're giving them the volume, and whatever pressure it takes us to deliver the breath, well, that's the pressure that it's going to give, and that's going to vary from breath to breath based on the lung dynamics. However, when we are in pressure, we're telling the ventilator, push this hard. And so that can guarantee or reassure that we're giving the patient a safe prescribed pressure that you and I have set up in the ventilator, but that doesn't guarantee a certain volume. So our volume is going to vary from breath to breath, again, based on the patient's lung dynamics. So how do we know which one to choose? Well, the good news is that most of our patients in the pre-hospital setting are going to do just fine on either volume or pressure as long as you're setting appropriate ventilator settings. Again, based on ideal body weight. We're going to get that tattooed on our forehead so that we always remember that. So how do you know which one to choose? Well, when I have a patient that is acidotic, I want to make sure that I am blowing off an adequate minute ventilation so that I can offload that CO2. So with patients like that, I'm going to be more likely to give volume breaths because I want to guarantee that I'm blowing off that CO2. Whereas patients who have delicate, fragile lungs, maybe if they have ARDS, or especially if it's a young pediatric patient and they have tissue paper thin alveoli, I'm going to give pressure breaths because that's going to guarantee that I'm very gentle with the breaths that I am delivering the patient. Now, I will tell you that my default preference is that I typically start with pressure ventilation, unless I've got that really acidotic patient and I know I need to guarantee that minute ventilation, because I want to make sure that I'm not hurting anyone's lungs. But you can always change if you're finding that it's not working for your patient. So this is just a 10,000-foot view of some very basic concepts of mechanical ventilation. If you want to know more, go follow my friend Melody Bishop RT. She'll teach you everything you ever wanted to know about mechanical ventilation.